That should do it.
Hi,
Hi, Dr. Huckaby. How are you?
I am doing well. How are you?
Doing all right. I say it before each show. I feel like I've repeated myself. I've done like four podcasts in the last 2 days, but we
Okay.
I gutted out the podcast studio and turned it to a gym.
Heck
so
yeah.
so forgive the background. I've just for the last 6 years of my life, 7 years podcasting, we've had this really built out studio, like all sound insulated. The whole thing. We called it the cognitive cave, right?
Yes.
But we haven't been doing any in studio podcasts, right? So people are staying
Yeah.
away from each other. So I'm like, you know what? I don't need that whole studio. I need a punching bag more than I
I
need
love
that.
it. No, I am all about that. Make it practical, livable, real
Yeah,
life.
yeah,
Yeah.
and we came out to a much smaller house too. We're on the beach, which is nice. So you can wake up and see the ocean. I'll take it. But we downsized big time when COVID was coming. We're like, all right, forget chancing it. That's it. We're leaving the sort of suburbs, if you will. We're out of here. We're going into
Yes.
hibernation at the
I
beach. We're
love
done.
it. I love it. I
And
speak that language too. So
where are you at?
I'm in San Diego. What about you?
Florida.
Florida. Oh,
Yeah, New
beautiful.
Smyrna Beach, Florida.
Oh, nice.
So
I've
I was
never been.
No, well, you got good beaches. San Diego's beautiful. So I've been there, I think, just twice, and each time it's gorgeous. The weather's wonderful.
It's beautiful. Yeah, they told me I came from Texas originally, and they told me, people that go to San Diego, they never leave. And I was like, I'm from Texas. I will leave. And then I came, and I'm still here.
And you're stuck. So you're not on the mass exodus, right? In
I
quotes.
I mean, I'm playing with it, but not quite yet.
Oh, considering though, considering
Considering,
going back to
yeah.
Texas.
Maybe not Texas, but you know, gosh, there's so much Texan in me that I can't rule that out either. So all my family is in Texas, so it's very near and dear to my heart. So it's definitely a possibility.
Oh, it's already decided. I can tell. You already. If you're going anywhere, you're going back to Texas.
Get some wide open space and some land, and yeah,
See, look, you're already planning it. See,
I know,
you've already
I know.
planned it out.
Busted and busted. You diagnosed
Yeah,
it.
most of the Floridians, I'm born and raised Floridian. I tend to come back. I've lived a few places, but I come back. I like water on all sides, well, mostly
Nice.
all sides.
Yeah, yeah. No, it's so healing for me. That's one thing that's hard to get me away from. The ocean in Texas is quite different, and where I'm from, I'm actually from the Panhandle, so there was no ocean inside or water. I mean, there were a couple of lakes, but that was about it when it came to water. And the ocean is just something all on its own that you can't really compete with. So,
Yeah, why do you think so many people flock to the ocean? Because I have a theory.
ooh, I want to know your theory. I have many theories. I think that when you go there, you just feel held, and it silences out the world. Even if you're like, in a parking lot that's right close to, the 101, it has this magnificence and this presence that can just like white noise out the rest of the chaos, and you just go there and you're submerged in nature whether you want to or not. And it's so powerful, and it competes with the sky in magnitude. And I think it just, it stirs up all of that childlike wonder in us, because it's terrifying, but it's beautiful, it's refreshing, and there's so much mystery in it that I think we just can't look away from it. There's something that captures um, everything that makes us excited and filled with wonder. So, what's your theory?
Well, how do you follow a beach promo ad like that?
It's
I can't follow that ad, but yeah, that is yes, you nailed it. But and points of my theory kind of reach to what you're saying is I think people flock there because when you walk the beach, you're on the edge of the unknown and the known. You know the world to your left depends on which way you're walking, right? But the world to your right is unknown. It's full of monsters, possibly in your mind, right?
yeah.
Its food comes from it, right? There's this just vast unknown, and I think we flock to it not only for the sun, that experience, everything you spoke about for sure, but that ability to walk the edge of the known and the unknown, kind of where we really are in life, right?
I was gonna say it kind of parallels just existence in this physical plane. I think that's beautiful, and couldn't agree more, because you're right there, and you can touch it. You can go dive in deep, or you can just stay on the coast, on the sand, and not go in. And the depth, and the amount of mystery that you're willing to go into, is up to you. Because when I first came here, I didn't really want to get in much. I'd watched Shark Week, and it was like, it's cool. I did lots of board sports like wakeboarding and all of that stuff. And I was like, I want to surf, but just that idea of like what is underneath my feet, and here in San Diego and maybe even there too, stingrays are a very real thing, and but the more you go into it, the more you know surrender to its power, the more addicted you get to it, and the deeper you go, and the deeper you go. It's exactly what you're saying. I think it does parallel life in such a beautiful way. It draws you in, but something about it is terrifying, but you keep wanting to go in. You keep wanting to
Yeah.
go deeper.
Yeah,
Uh,
New Smyrna Beach, where I live, is the shark bite capital of the world.
oh, lovely.
Yeah, more people are bitten here than anywhere else. And I try to tell my friends, because I'm in that water just about every day. And I try to tell my friends, I'm like, look, it's the shark bite capital, not the shark death capital.
Yeah,
Okay,
it's different.
I'm like, they're
It's an
babies. They're
experience.
babies. You might lose a piece of your calf. It might happen, right? But
It's
other than
fine.
that, it's the best
It's
place
all
for waves.
natural, right? It's all natural.
It's fun, man. I certainly enjoy being by it. Kind of leapfrogging as before we start to kind of talk about what you do and what you practice. Uh,
Yeah.
I'm sort of on another theory, right? That medicine, and none of these theories are my own. They're stacked up from other people's theories, pulled into one, right?
Right.
To note
Oh, so
that.
then it is your own.
Sort of. I don't know. I'm
Yeah.
sure it's out there a lot, right? Is that the treatment and society almost seem to be tied in on a cycle, right? As if my one of my dogs has decided to have fun. Sorry.
You're fine.
Oh, he's wild. So, like, it's on this on a cycle of coming back to a naturopathy, right? That sort of almost through the ages you watch and you use psychology, right? What the main approach was in psychology, right? If you went back to I don't know 30s, 40s, right? You more or less had a demon in you, right? Something was probably wrong with you. You had to cast something
Yeah.
out of you, right? And then Freud comes along, right? And he's a crazy person. I like how he has some gumption. You got to say
Ah,
it's because you want to sleep with your mom. That's why, and he says this stuff, right? And we get into this psychoanalytic background, right? Then the psychodynamic background doesn't start to unfold until 60s, 70s, where you have this client-centered positive approach in the 60s. Imagine that, right? Carl Rogers, if you will, right in the 60s starts to happen. And then as 80s, 90s come along, you start to see this cognitive approach. It's what you're thinking, but technology's changing at the same time. And so it became all about what you're thinking and more analytical, some behavior behind that as well, not so much feeling and client centered. And then now psychology is brain imaging, brain mapping, pharmacology, right? It's gone technical along with the technical society.
yeah.
And you're seeing what I think is a change now back to before we had all of that, right? It was roots and water, right? It was natural medicine, right? And we cycled from that. And I see a cycle going back to that as if we're coming back where healing is now possibly coming off the technology zone it went into, right, with brain imaging mapping, but utilizing that to now prove natural healing, which was the very beginning of it all. Sorry for the elongated
No,
theory
it's
there.
beautiful. I totally agree, and that's kind of my perspective on things too. Is like things are much less beginning and end, and more of a wave. And depending on who you look into, if you ever look into like Walter Russell or whatever, everything is it's a wave to everything. It's a cycle. Even the earth has cycles and seasons, and it's exactly that. And so I agree with you. I think that we have changed with technology, but now I think the beautiful thing about it is there has been an unchangeable, factor there. And we just put a different language to it. So when we had more technology, we gave it a different story, a new perspective, a different language that we came up with when technology came on board. And so now we have new words to describe and all of these different things. But I think the beauty of it is there's this unchangeable nature, and exactly what you spoke to is like we go back to that always because that's unchangeable. That is the unshakable, the true, the light, the realest thing that's here. Like, you can describe it in so many different ways. Everybody has a different story. When we get new ways of measuring it and trying to understand it, we give it a different language and all of these different things. But what I have found is, like, the more that I looked into it, and when I came into the world of quantum medicine and quantum physics, it's just that we were finally able to give a language to some of these things that we still can't understand. And I think that's one of the biggest things for everyone to even understand now is, like, the amount that we are able to understand is magnificent, but it is nowhere close to the truest. Like, if we could truly understand the language of what is woven into our universe, we're nowhere near it. Like, I sometimes just think that, like, we're probably really close, and the more we grow, technologically, we have more to understand, and we're able to look for more things. And when you look for it, you find things. Um, but that doesn't mean they weren't always there. You know what I mean?
No, I certainly do. I like the exploratory approach you're taking to it, right? Is we are constantly looking to label things, to call them something, right? I argued probably on one of these podcasts, right, that just because you find a group of things that happen and we label it doesn't mean that's even a thing, right? So it's our
Yes.
social constructs applying behavior patterns to the world, the natural world, to ourselves, right, to our psychology even, right? And we call it something to label that to try to, I mean, mainly to better understand it, right? We got to label it to study it. The guy who kind of created stress didn't know what to call what he was studying, so called it stress, and boom, now we have stress, right?
Yes. No, I agree. And I think that that, again, really parallels everything that we're even experiencing in this time. It's much less of, this group is right and this group is wrong. I think it's so much more fluid than that. And if we could understand that and meet each other on that level, you would see that, like, everybody has a different story. And their story determines how they see things. And then how they see things determines what they experience. And so if you have a story and I have a story and I'm trying to convince you of my story and you're trying to convince me of yours, there's never going to be this, like, understanding. I think it's when we all, like, say, okay, this is what my perspective, what's yours? And then I think the beauty and the truth comes when you come from completely different angles, completely different backgrounds, completely different stories, and then you find commonalities, and you find those pieces where you meet in the middle, and, like, whoa, maybe we're onto a truth here. Maybe neither story is completely perfect. Maybe neither story is completely accurate. But maybe there's truth sprinkled into each of them, and it's through conversation, through, you know, listening to other people and their version and their perspective and their experiences. Maybe we can meet in the middle, and then through that piece together a greater truth. And that's kind of what I found in medicine too. Depending on what your story is, it's going to depend on what you resonate with. And I've talked about this a lot, with our current events. If you're trying to strip away, for instance, some people look at allopathic medicine as, a parachute, their safety net when it comes to, living. Most people are afraid of dying. And so when they need to trust in something and they've been trained to not trust in themselves, of course you outsource that to what? Medicine. And so if they have never even, if their story is, okay, so I got a cold and then I took this pill and then it suppressed something, but their story said, I took this pill and it healed me. But my perspective of that story was, you took a pill and it suppressed symptoms that you're later going to have to pay for through chronic disease or through these other things. It's a different perspective. And so to try to strip away their safety net through my story or my understanding is doing a disservice to the individual who that's not their story. So I think the story piece of it is really where we find humanity, where we find love and caring. And you don't go and try to argue with somebody that, believes that a mask is saving them right now, or believes that a vaccine is the answer, because they've probably never experienced naturally healing from a flu, or naturally reversing their diabetes, or naturally reversing, a bigger condition. And if you've never experienced that, and you're faced with the biggest, most terrifying story you've ever experienced, a pandemic, and then you want to strip that away from them, you're like, no, nature and eat and, move and all of these things, like, that's not their story. And you're trying to strip away something that makes them feel safe. So I think exactly what you've brought up here is so powerful. Like, if we could understand the true story, understand the truth here, that we've been misled, that there might be another version. And what if we communicate? Because anytime there's, a debate, how timely again too, you go in aligning with your story and defending it with all you've got, because you got to believe in something, right? And so you associate your story with, I am this. And if this is wrong, then I am wrong. And so if I'm wrong and you're right, then I'm still wrong. And so I need to be right. And so there's just no softness there. There's no, opening to maybe perceive a different story. And I think now more than ever, we need to look at all of those stories. I think we're being forced to look at the stories and see the ones that, might not have the foundation that we thought they had, and maybe we were misled, and maybe we've been lied to about a lot of things, and maybe we're more powerful than we ever imagined. And to try on a couple of different perspectives and have the compassion to understand the perspective of somebody else. I was talking the other day to a group of people. I've never prescribed a mask to anybody to optimize their health. And so, looking into the research of, even if we were to consider this to be true, it doesn't promote health and well-being. And, so there's some people that feel like they should be vocal about these things and confront people wearing a mask. And, I don't think that's the way that we do it here. I think that if you're playing, within their game, and you're doing things through fear and trying to, scare them by like, oh, you're creating hypoxia in your body and that causes cancer and all, like, you're fighting fear with fear. Yeah. What if we start going with truth? And like, I was just thinking the other day, I was running at the ocean, and like, just like we were talking at the beginning, like, it's such an experience. The smells, the way, the air hits your skin, the feel of the sand and how it's soft when you get closer, and then it's harder when you get more inland, and just the beauty of that moment, and I'm running past people, of course, with no mask on, and they're walking in a mask. And instead of being like, I can't believe you're not woke enough to believe these things, like, instead it just like hits my heart in a different way. Like, they're so fearful. They've never got to feel the beautiful gift of what it is to trust in this and trust in what they have. That their fear is preventing them from experiencing the beauty of that moment. They want to be there so badly that they'll go, but they're going to still, prevent themselves from breathing in that salty air, experiencing the beauty and the softness and the grace of that moment because of this level of fear. And, it made me think again on that same run, like, what is the most beautiful way to speak to this? Because I want them breathing. I want them knowing that they're safe. Because there's a part of me that's really mad and like gets like that, anger of, what is being done to people during this time through fear, and you want it for other people out of love. And, I was just sitting there like, what if, take a scenario of like, a woman that goes to the ocean every day and she can't run because it just suffocates you and it's uncomfortable and you get lightheaded, and it's just not quite the experience you had before. And they see other people playing on the beach without a mask on, little kids going into the ocean free, completely careless. And so she keeps going back and seeing these people just living and playing and breathing in the same world that she is terrified of, the air that she's terrified of, they're breathing freely. And what if one day she just got tired of it? And instead of somebody confronting her and trying to convince her to take her mask off, what if in that moment she just was like, I'm done. I'm ready to breathe air. If they can be okay, I'm going to try it out. And in that moment, I think that's the beauty. I think that's the shift when she experiences it for herself. You don't convince her. You convince her through you living life in a way that is truth for you, and being like, hey, I'm breathing. I've been breathing this whole time. And, then just like, letting your life be your message instead of this confrontational, I'm right, you're wrong, I'm woke, you're not, you're a sheep, I'm enlightened, all of these things. It's still this separation, and it's still feeding into this whole thing that if we all just stopped, it was like, what if in every moment we came into ourselves and like, I'm going to take it off and see what it feels like to breathe. And then what if that leads to, okay, I'm fine here. If I get the flu, I'm going to not take that, and I'm going to try these foods and these supplements and these herbs. And then that leads to, okay, what if you can heal from an autoimmune condition? And then you experience that, and then you get this snowball of like, I don't care what they like, what fear story they come, like what new bug they come up with, or what new thing they come up with. There's this like unshakable nature, not because you were trained, not because you were told, but because you experienced it. And so for me, like that experience, that moment where you step into what is right for you, and like I might be wrong, but I'm willing to prove myself right or wrong. Either way, I'll know.
That's a shift in the story, right? I mean, you covered a lot there, but a shift in a story of somebody's own mind, of what their story is, what the world is, what other people are, what relationships are supposed to be, all the way down to what government is. These stories concrete into people's lives, because without a personal perception defined as truth that we call our story, then it can be rather scary in what we're experiencing, right? We're taking a moment of, quotes, consciousness, right, as far as we know, and consciousness that is here, and I have to frame stories around this, right? This is what the government does. This is what I do. This is what I believe is what people should do. And those are concrete stories based on beliefs, right? I write a lot about that in my book, actually, about how we hold on to experiences to shape our lives based on beliefs that concrete into our whole mindset, right, over time. And down to the story to let go, the moment that you were talking about, I understand where it's. I actually even wrote about it, how it doesn't have to be gradual. People think that like change is this gradual process, and I try to say, think about all the evidence, quotes, you had to gather before that one time in the example you used to take the mask off, right, or to be something different, to try against somebody else's told to you story. For what got you to that moment, right? Why can't you just skip all of this evidence building, since all of this evidence building is subjective anyway? It's just your perception anyway. You're gathering a subjective experience over time to develop subjective evidence for yourself to change your mind in a moment. Well, if all that is subjective, just skip all that shit, and you can go right to right now, that moment of, for your example, to take the mask off, right? To try something different, to move wherever you wanted to quit your job, right? To try a new medical approach or something like that. Why not just do that moment, right? And I mean, I know why we do the moment as a human. I
I
kind of
wish.
explained it, but I'm like, all of that evidence shit is subjective anyway. You're wasting all your time gathering subjective evidence. Just make the change right then and now, right?
Oh, if it was only that easy. But there's so many lessons too along that journey too, because I think what you're speaking to now too is, I think what this consciousness really is making us see things that we didn't want to acknowledge, that we knew, that we saw, that we felt. Because before now, it was really easy to be like, no, they're not. There's not poison in our food. There's no big business. There's no,
You're right.
big pharma doesn't do all. It's not all manipulated. And because I came from small town West Texas, and there was an innocence to me. I trusted medicine. I trusted government. I trusted everything. And I thought what people said was what they, intended. And, you go into the real world, and part of what's happening right now is we're being forced to see what's in the room. We're being forced to see what's, behind the doors and hidden in the closets all at once, all right now. And it's making us stand there and be like, okay, we have to see it. Now, are you courageous enough to see it, to be here, to see all that is here? And then now, be okay with, really, it's a loss of innocence, I think, that we're, collectively going through, this loss of like trusting daddy government and mama medicine, and trusting
But
things
the
that
hard
they are.
part is, can they make that turn though without responding in fear the opposite way, right? Waking
Right.
up to an illusion, or to what you see as subjective and forced into a mass population. You wake up from that, it's hard not to be then angry at that
Yeah,
and come back at that with the same anger.
exactly. And I think that's where part of my biggest work was too, because part of my story is, you know, a lot of that. I was forced into a different path because of my own healing journey, and there was anger there because most of it probably should have never happened, but because I blindly trusted, and there is an anger there. And I think, with emotions, they all do have different frequencies, and But at the same time, there's no good or bad emotion. They just are. And we put, again, a story to anger. We put a story to joy. These are good, be these. These are bad, don't be these. But I think there's a power to anger. And when I started studying
Yeah,
healing,
I agree.
in spontaneous healing, one of the most interesting things that actually got me looking into emotions was spontaneous healing of cancer through an extreme bout of not joy, not gratitude, which you can do that too, anger,
Wow.
an intense expression of something felt within the physical form. And I found that so fascinating because, you do hear some of the stories of an intense moment of gratitude, just where you felt it all in your body, and these people heal in these beautiful moments. But I was shocked when I came across that, and I was like, anger. And then it made me look into, just be like, what's okay? I'm putting my judgment and story on this word that we call an emotion, which is still just neuropeptides that create a sensation in the physical body. Um, what if it's not good or bad? What if we quit trying to put them in categories and containers, and we're like, there's a beautiful piece to all of it. And what is anger? It's very mobilizing. And so I think what happens is, if you use it as mobilization,
Mm-hmm.
powerful.
Mm-hmm.
If you stay in it, pathology. And because we can't just be. You could be. I never say you can't do anything, because the more I work with people, the more I'm just like, you never want to say what people can and can't do, because it'll come back and bite you or just shock you. Anyways, but I just think that there's just so much more to all of this, and I think that moving through the anger phase is necessary, and being angry and feeling all of that and feeling it fully, and then moving through it and going to, like, okay, now what? We're mad. That was not cool. But now what? What part? How can we start turning this towards healing? How do we make this energize me, heal me, motivate me, inspire me? How do we turn it? The alchemy of it. Turn that into something beautiful and powerful, and make a change, make a difference. Don't stay in it. Don't stay stuck. Um,
There's
because
practices in psychology that play off of what you're saying, like the empty chair, right? Like the empty chair intervention. Some people don't know it unless you've been to therapy, right?
right,
If you explain that to people on some level, they would kind of go, "What are you doing?" Right? But research would back up the fact that if I put an empty chair in front of you and say you had an issue with your mom or your dad or something, you imagine your mom and dad in the chair and you talk to them, and then you also do that with yourself. Imagine you're in that chair, and what would you say to yourself? And this is a proven intervention that is helpful, right? And most people would be like, that's not scientific, right? That doesn't. But yes, it works. There's research to doing that and just getting those words out, right? And saying those words in a place. So I'm trying to help people understand that kind of uh, how wide the net can be when it comes to healing people just at a psychological base, when you're just coming from a psychological practice, much less utilizing anything else. And so the emotion, I too agree with you as anger being a very powerful tool when applied properly. Um, you did make me look up to the right a little bit when you mentioned the idea. Um, how come we can't change what emotions mean, right? So why can't this be good, right? This be a good thing that all emotions we experience sadness, right? But as you also says, we've boxed those in as being whatever sadness is, and then it made me think like, shit. How could we get rid of the social constructs that make us create those emotions to be that, right? Like I'm supposed to be sad if XYZ happens, right? Pick a Lifetime movie, right? Pick a drama movie. Well, those things I'm supposed to be sad, but we associate that based on social constructs and then call that emotion something when we feel that emotion at some level. Again, open to subjective changing, right? Again, right? This isn't reality if you recognize the social construct is what's shaping you to create that emotion, right? And that I could move that and apply that in other areas of my life and use that in different aspects, right? Kind of like that. That's sort of only the cusp of what you practice, though. Of that's barely
yeah,
walking into the tip of the iceberg, though.
it's a huge piece, though, because you cannot, from what I've learned, you cannot separate the mind, the body, the spirit, and expect to have optimal health in a
I would
being
agree.
that is all of those things. So, to diminish even that, I think. is missing out on a huge piece of what it is to be well. I always tell my patients, like, I'm never going to tell them what is possible for them. And part of it is, you know, and I tell them up front too, like, if you get this on a certain frequency, instantaneous healing is possible. People have done it, but it's so much work. There's so much indoctrination. There's so much that has been just piled on us that's not even ours. And so I think a lot of what I do is I help you remember the power of this, and that starts unraveling the rest. When you start having certainty and a belief in your closest thing, then you can start looking into those corners of your psyche, of your traumas, of all of the things that you felt and experienced. Everything that has touched you in any way matters. And everything is held in your consciousness, in your biofield, in your physical body. It's how this works. You know, it is scientific, the true capital S science, not this other man manipulated, big pharma funded stuff. It's the most beautiful science. It's the sacred science, and it's all very real, and it all matters. Because why can you get some people, you know, to have beautiful, perfect labs, perfect, and they're like, I don't feel right. Are they wrong? No, they're not wrong. They're perceptive. They may not be able to put a language to it of like, okay, let's go there, or what's there, or what else, you know, have you covered up and suppressed? You know, that we've just been trained to suppress, 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 and you think that goes nowhere. That's not how this world of frequency and energy works. You don't just tuck it away and it scares. Often we tuck it away and it grows.
Well, couple that with the, I don't know, quadruple even doesn't even do it, with the infinite amount of information now that is receivable to us in a matter of 2 minutes in our eyes and ears, right? And how we pull that. And I'm not so sure our I don't know, fleshy little body here with this little brain we got is quite evolved yet to the time we're at to access this much information at once. At least the human psyche. I mean, we think we sort of understand it, but we have no idea. And so, God blasting it with the information that we get constantly now, there's got to be side effects. You know, there has to be, from just a scientific level would just say, common sense wise, there's got to be some after effects of this or some side effects that are happening. I mean, even the psychological approach to helping people, you know, is limited in so many ways too, right? When we're talking about depression or anxiety themselves as experiences, something we go through, these are symptoms. And I think a lot of the times, you know, depression and anxiety are good things, and say that out loud. And I mean, I've experienced anxiety and depression. At the time, it is not a good thing. It's terrible. But I think sometimes it's a almost an alarm for us, telling us, get the fuck out of here, right? Whatever you're doing, where you're at, where you're living, how you're thinking, where you're working, get the fuck get the fuck out of here. It's trying to tell you that before. I think the body is like the last one to start taking the shots. You know, the mind is trying to tell you, dude, we're depressed, we're anxious, have a drink, we're in some bad shit here. This isn't cool. Then after a while, the body starts to break down too. But I also loved how you said mind, body. These are the same things, right? I first started writing my book, and I don't think I've ever said this shit. As I wrote this part of the book, and I was using this mind, body, spirit separation thing, and then I knew the pushback I was going to get back from a scientific community on that side, trying to talk about it in different ways. And so then I found ways psychologically to speak about and separate the two from more of a behavior standpoint as the body, right? What we're thinking, how we're thinking, being the mind standpoint, and the essence of who we are in our environments, right? But that really, I meant mind, body, spirit is kind of what I was talking about. And I tried to sneak that in there past people. And I think I did successfully, right? But I think the people that do understand the mind body is really one. It's not a separation. May pick up on that kind of idea, right? I was trying to relay that other side and pull them a little bit this way too, right?
Yeah. No, I agree. It is all one. Just like, you know, the idea of having cardiologists and pulmonologists and dermatologists, like, it's very reductionistic. And I think too, the next layer of that is knowing that the psyche, the spirit, the soul, You cannot separate these things at all. It's all one. We're all one. And I will kind of challenge you a little bit. I think we do have the capacity to be here in our most embodied, fullest, expressed version. But I think, again, it goes back to that innocence. And when you lose your innocence, if you do not replace it with intuition and a deep knowing and deep wisdom from your experiences and from, what caused that loss of innocence, then you're easily manipulated and you're scattered. And that's what we're seeing right now. People are scattered. They don't have that solid foundation, that knowing, that unshakable nature. They've never had to use it. They've outsourced it. And that's what we're seeing now. But I think even with the information overload, innocence is just letting it, like, so much, just constantly coming from every angle. That's the innocence, just like letting things happen and just like being here and like, oh my gosh, now this and now this. There's an innocence to that. I think the intuitive, growing pains is the focus. Like, let this come at me. I will digest it. I will see it. I will stand here. I will hear it. And then I'm going to digest it. I'm going to, direct my focus where I want it with my goals. That's what I tell my patients all the time. If you come in, that's how I do medicine too. People come in with like unbelievable amounts of symptoms, chaos, just freaking chaos. And if I were to chase down every symptom, oh my gosh.
You'd be on 14 pills just like mostly everybody is.
And they would need to be with me for the rest of their lives because it's like, okay, now we're going to tackle this. And now, but no.
It's reactive medicine. Our medicine today, although does amazing things. It can replace organs. Right. It can do some life-saving, amazing things. There are some amazing drugs out there that save people's lives. I get it. I mean, some of that stuff, if I'm in a car crash, I'm bleeding, right? I need some of this stuff. I can have a whole metal robot leg. That's pretty fucking cool. You know what I mean? There's some advances there that I appreciate. But I think, like you said earlier in the podcast, is we become attached to them, in need of them, and then we're sold that as well, right? So that this becomes a structure that then attaches to our story of what life is and everything you explain. So I kind of want to put that out there that there's some that it's some great stuff.
Absolutely. I think everything used properly, and in a true, genuine way.
That's a big word for our medical model right there.
Right.
Wait, we have a for-profit model and we have to use it properly?
Yeah, right.
Yeah, right.
And that's what I talk about all the time, even when we talk about research. Like, I find it fascinating, that we control for something like the placebo effect. And like, what if we pause here for just a second? That means that
that's funny how it got called a placebo effect, though, right? It's
we
still an effect.
Tuck it away in the corner. It's a thing. And I'm just like, why aren't we studying how they did that? Because what happens is, in this model that we're in, they don't want you to know that you could do that on your own.
I can't sell a placebo effect. Exactly. I can't sell a placebo effect.
Just like you cannot sell the sunlight. Just like you cannot sell, all of these other things. They found a way to take, nature and earth and monetize it with our food and our land, which is mind-blowing.
That had to freak people out. The people that were alive, probably still today, before bottled water showed up. When it wasn't a thing and then bottled water showed up, you had to be like, it's over. It's fucking over.
What's happening?
Yeah, they bottled water. It's over.
But I think, eventually, in my ideal world that I like to think about sometimes, medicine will be available. I think medicine is a fundamental right. And I had this, mind-altering moment when, I started my practice of like, why do I have to sell this? People being well and living, they have to pay for that? Like, it just blows my mind. Like, in a world that makes them sick, they then have to pay for wisdom and information and understanding to be well. And I was just like, wow.
Or dedicate their life to a practice of it. I mean, you have
to. That's where you liberate yourself. That is true freedom, and that's why I do what I do. Because I think if I can teach you, if I can translate the language of your body and help you understand its language, and teach you how to listen to it, and teach you, like, Is this a pathology or is it a power? Is this you responding to your environment in a way that a healthy body would respond to an unhealthy environment? Or is it a pathology? Or is this a symptom of healing or a symptom of disease, disorder? There's difference. Again, we've just been taught one story of it. But I started learning when I actually look at it not from a way of like, oh, this means this, which means this, which puts you in this algorithm, which means this, 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 this. That's why people don't get results. That's not how this works. The body speaks in its own unique, beautiful language, and we just don't know how to listen to it. We have joint pain, and we have these, like, you can have emotional homes of like, you always experience anxiety, so when you feel excitement, no, it's anxiety. We have a story. That's our emotional home. You can do that with your health and well-being. A lot of people that have had to heal through chronic disease and invisible illness and autoimmunity, we have a home that we think, like, if we feel anything, it's pathology. And so a lot of times with my patients, as they go through this healing journey, they have to unwind that story of like, oh my
Well,
gosh,
hence the reactive medicine. Its real response is to numb.
to
On
numb.
some level, on a very basic level, any psychotropic medication I'm giving you, in some sense, unless I got some, ADHD or some Vyvanse or Adderall, other than those things, right? The point is to calm. Even the way that effect actually works technically, is to sedate. It's to numb the feeling of anything, be that sadness or any experience.
Yeah, exactly. And that's numbing the way we interact, to go large scale again with our world, with our existence. We're very much a part of this universe, this natural world. And when you can't communicate with it, when you cannot feel the sensations of it, when you cannot translate its language anymore, because you can't even produce a reaction, um, I think that's the furthest thing away from health. And I say it a lot, like, a patient that can't feel pain to me is more terrifying than a patient that's been in a lot of pain, constant chronic
Yeah,
pain.
yeah.
If you cannot feel, I've got so much more work to do than somebody who feels so much.
Well,
We just have to.
hashtag sociopath, right? That's what you get. That's what you get pulled into, right? That's what you become. I've often argued left field. I squirrel off on this podcast. People, they make Instagram posts and things about how bad narcissists are and all this other stuff. And people forget that that's a mental health diagnosis. So we can talk about how bad narcissists are. If we ever said that about people that had depression, oh, the
Mhm.
people with depression are so terrible to be around. You can't be in a relationship with them. It's all about them, right? People would yell at you. But narcissism is an actual disorder. It's a quotes personality disorder, and people forget about that too. Just back to center field. Sorry for left field right there.
That's
Right?
fine.
Just something. 10 seconds in the mind to me on an average day, right? When I'm going, wait a
Yeah.
minute.
Yeah. No, and I think always question everything, because that's part of my medicine too. Is like, I started realizing that, we just look at pills and supplements and the lucky few, food and water, as inputs that have an effect in our physical body. Everything has, like, everything is an input. Everything you see, feel, hear, things you can't see or hear, frequencies, all of these different things have a physiological response when received by our body. And so, I like I liken it to, like, say an individual sat down and was eating, just regular mushrooms, sauteed mushrooms, and they ate it and they felt fine. Say the next meal, they sat down and you actually gave them psychedelic mushrooms, but they looked like regular mushrooms. They were cooked the same.
You're welcome.
They had a different response, right? They had a different response. And if they didn't understand the input that they just took in, they would be like, I'm messed up. I am diseased. I'm schizophrenic, bipolar. I'm everything. I'm hallucinating. Like, I'm messed up. You had a proper response to the input you took in. How many inputs do we have no idea what we're even taking in through television, through 5G, through light, through all of these things that we don't consider to be an input in this physical body? And so part of what I do is I study the person, listen to the language of their body. What inputs are in your environment, and what if the response you're having is a proper response? You just didn't understand what input you were putting in. You were consuming psychedelic mushrooms thinking that they were regular mushrooms and having a response that was the same. So are we misreading pathology?
Well,
You know?
comparing your mushroom story, right? Substitute the accidentally ate psychedelic mushrooms with I accidentally got married, had kids, and got a 9 to 5, right? And I've been doing this 20 years of my life, and something's wrong, right? You're speaking to a social construct. Pick any life that somebody leads, right? That's the kind of the wake up from it, right? And a response from it.
Yeah. And it matters and it changes things. And when you understand, you know, that it all matters,
Well,
that everything
people
is,
can understand, I think, on a level. If you tell them environment matters, right? Most people are going to go, yeah, okay, yeah, environment matters, right? But then if you told people, well, then break down the environment, right, and remove a few things at a time from the environment. What you're really seeing is that a few things make up that environment, right? Picture your worst environment imaginable, right? You got fire, all these other things. Well, if I take this out, I take this out, I take this out, right? And now all of a sudden, the environment's changed. So it could be something as small that you don't think about that's creating that environment, or as a piece to that entire environment that you piece apart. And I think that is a common sense way to kind of explain to somebody that you know environment matters, but you also know that environment is made up of a bunch of little tiny environments, right? That collaborate to create that environment you have. So let's not forget about the things that make up the environment, not just the environment as a whole.
yeah, exactly. And I think that's powerful when you actually can zoom out and be like, whoa, so light has a physiological response. It can impact hormones. Wow, didn't know that. What kind of light am I consuming? What air matters, toxicants in products matter. Everything, when you can start breaking it down and be like, whoa, that's a lot of inputs. Like if you were to substitute light for a pill and conceptualize it that way, be like, wow, I am taking in a lot of different
Well,
things
they
that I
try
need.
that with vitamin D supplements, but it's
Exactly.
not the same.
No,
Right. Yeah,
it's not.
Dr. Jack Cruz, who's been on this podcast 2 or 3 times. I don't know. You know his work?
Yes.
Yeah, he was kind enough to even write a cool read this book kind of thing on my book. It was awesome. But I had to mention him, and until he came on the show and his work, um, I had not opened my eyes to this, right, and really noticed anything like that, and had to have him on a couple times before it sort of clicked in me, because he can talk way up here,
Yeah.
he's talking on molecule levels and things. I'm going, sounds good, right? But at the end, and I started using some of the methods he was talking about, like grounding in the morning, right at sunrise, tilting your eyes off a little bit for each amount of time, X amount of time in direct sun. I started applying some of that stuff, and oh, damn. I was
Right?
like, yeah, just holy shit. And until you get in. Now, whether that's placebo, whether I wanted it to work, I went into it like a skeptic, like, all right, this dude's just crazy
I'm
smart.
gonna pause you there. Let's quit writing off placebo like it's not a thing.
It's still a thing. Right,
It's
right, right.
the biggest thing.
I wanna look. I do want to research, as if we didn't have a device, as Steve would always say. He was a producer of the podcast. We'd be in studio and we'd all have this question. He'd be in the corner producing. He'd go, as if we don't have a device to look up all things, right?
Right.
But like the name of
Doesn't
like,
mean the answers it gives us are accurate, though.
right, oh, right. That's determined too. But it got the bad name of placebo effect, right? Why not? Why not the miracle effect, or the amazing effect, right? That happened.
Something powerful. Yeah, no, I agree. But sunlight is such, and if you can just think about sunlight by itself, we've demonized it. We have made people fearful. Like before, we've made them fearful of the air with coronavirus. We made them fearful of light.
No,
And
I live on the beach. I can smell when I walk out back, because we're next to like a public parking area, sort of right here. And I don't want to tell anybody where, but at a little park. Um, I swear to God, I can smell the suntan lotion, or the sunscreen from across the park, man. And I'm like, all the way across the park. I'm like, well, they're all here today, wearing that stuff on their skin.
yeah, well, and again, that's a level of fear that a lot of people haven't unraveled, and it's a fear of your natural world. And so we go again back to this fear, like the fear of something that we haven't even really like. If you just step back and think about it, for a second, you would kind of start calling bullshit on it. Like, why would every other organism on this planet need sunlight, and we don't. We need to hide from it and slather our skin with chemicals to protect ourselves from it. Like, once you start just like kind of picking it apart, you're like, wow, like, okay, that doesn't make any sense at all. And what if it is the most potent and powerful medicine that we are designed to utilize? And once you start looking at what it does with the hormones and neurology and how we were made, we are light beings. um, there's this beauty too that I think you can fall into again, where your world is medicine. Every moment of it, every part of the day, the sunrise is its own type of medicine. The midday sun is a different kind of medicine. Sunset is a different kind of medicine, and it's there all day for free,
Yeah, but
not
you,
asking for a
but
thing.
come on, you're asking people to look past not having enough in savings, to look past not having the newest lawnmower, to not take that vacation they get of freedom 2 weeks a year. You're asking people to wake up from and you mean I can enjoy my whole day when I go to a job I can't stand, right? So you're asking them to lift social constructs, right, in their lives that weigh them down. That's a huge ask. And I make that comparison because the simplicity of what some people call natural medicine or naturopathy, the simplicity of it, when you look at the complexity of the problem that you keep creating yourself, right? It feels like it can't be that simple, right, as those things. But when you really break it down and get into it, it's difficult to really apply, and the constructs you have to get through are quite reinforced.
I always, I love this conversation too about the simple, because from what I found, I got lost in research and all of these different things, and went down the intellectual, like pick it apart until you get into quantum physics. Like that's how I ended up there. Like, holy cow! Like this is actually so very complex, so very complex. But then Einstein even says, like, if you understand something completely, truly, you can explain it in the simplest form. And so the simple is often the most profound. But again, we've been trained to think like if it's not sexy and complicated and you have to get it from a doctor and you have to have a prescription for it, then it is nothing. When it's, again, it's a story, and like again, that wave and that cycle, you go back to,
The
there's
response to
so
that again, though, is because I can't package the sun just yet. I can't package certain things. I mean, look, this entire pandemic, what I did not hear anybody except a couple podcasters and people talking was up your vitamin D intake, get outside, get some sun, move around, drink a lot of water, stay hydrated. Please, God, sleep. Get 7, 8 hours of good sleep. Reduce your stress effects right now. Nobody said that shit. I mean, on a mass whole, right? On a mass whole, nobody was saying that. It was hope to God we get a vaccine. You know what I mean?
right.
Hope to God they have pills and ventilators that'll all this reactive shit, man.
But I
It's
think it goes back to that story. Like, if you have never even been able to lose weight naturally, how are you going to trust in yourself, in sunlight, in clean air, and clean food in a pandemic? People have been stripped so far away from what they're capable of doing
good
without
point.
somebody else,
Good point.
without an input. Because, like, what I tell people all the time, too, is like, yes, we can use herbs and supplements and all of these beautiful things to elicit a response in you. But I would be lying if I said that you couldn't do it on your own. If you are able to have that response, you can do it on your own. If you look into, even, again, we'll go into schizophrenia again, those individuals are able to go into an altered mental state on their own. They don't know how to control it or regulate it. What is society obsessed with right now?
I I
Psychedelics, all
I
of
I
these.
met a few. I treated a few
Uh-huh.
schizophrenics pretty often for some years. Sorry to interrupt you too.
No, you're
Please
fine.
don't forget your spot, please.
Okay.
Um, and I can't say his name, but there a gentleman I will never forget. And I had often heavy homeless schizophrenics that would come through clinic. I'm talking deep into it, 20 years on the street type, right? And live that way. After a while, I don't want to say they were my favorite patient, but most intrigued, and oftentimes did feel that they lived on a different level than me. And when I started looking up the definition of schizophrenic, and I realized that it's audio and visual hallucinations, but those are only hallucinations determined by the masses that don't see it. So, in its actual definition of that, it says that the majority of people don't see, right? It subscribes to basically saying the masses don't see it, so therefore it's a disorder or a trait. And I'm going. Wait a minute. So something just because we all don't see it determines it to be a disorder or a symptom of a disorder.
Exactly.
And some of these people are the most intriguing people. And the guy, I'll call him John. Um, he knew how he could elicit certain responses. He was a fascinating individual. Fascinating. He never wanted the help. He never wanted the help.
Yeah.
Somebody would bring him in, and he'd be like, "Look, man, I like living in the woods." And he's like, "I'm good out there. I'm fine, right? I eat really good. What I find and stuff." So, but anyway, my point, as you were saying, is studying the 3, 4, 5 years treating those individuals. I really do lean toward they're on another level, and I don't mean one like below our level. I kind of mean when they're in another place, or maybe a step in our evolution, right? Maybe
Or
they're a
maybe
step.
showing what we have that we haven't been able to tap into. A lot of
Shit.
people that
Yeah, I
I
like that.
with, we as they heal and understand, like, oh, this wasn't a pathology, and then you talk to them at how they see the world, what they're able to see. I talk about this all the time too. Like, very rarely do people come to me and be like, "Can you create a loss of function in me?" No. What's the biohacking community want? Gain of function, more sensitivity, more perception, more. And yet, when these individuals come into this world equipped with this, we call it a pathology. Again, go back to the mushroom example.
Yeah, yeah.
They're able to do it on their own, and we're obsessed with these compounds because we want to feel what they can do.
Mm.
You know? But we've called them pathological. And the more I look into the very hidden research, the more this is parallels so many different conditions, so many of those titles that we hand over to people. They're like, oh, you're pathological. You know, from what I've looked into, that is very rarely the case. Pathology is often the ones that can't sense, that can't feel, that are desensitized to their external world, not the ones that see things that others can't, or feel things that others can't. We've just again given such a story to it, and I think that this limits us from what we're capable of, because it starts putting labels on it. And so if this is pathology, then we're not going to want to go explore that and explore the beauty of it, just like the placebo effect. Very few people are like really looking into the magnificence of that.
Yeah.
um, and a big turning point for me in my own medicine was when I stopped studying pathology and I started studying healing. Because I was like, this doesn't make sense. Like, I could
Hmm.
explain pathology down to the finest point, but like, I'm in a profession where I'm supposed to help people be well. Like, maybe we should kind of flip the script on
That's a
that a little bit
genius point because
and
all in
go
psychology,
into
you're right. It's teaching the etiology of manifestation. How does this is how
what's
this has
wrong.
become a thing. We call
Mhm.
this something, and here's the pathology. Here's our proof that this is a thing. So
Yeah,
I like that your idea of they were it's working backwards. Here's a group of negative symptoms we've grouped into a whole that has
yeah,
developed this thing, rather than looking at a healing response to it. Again, preventative versus reactive.
yeah. Well, and once you start studying, like I started looking at research studies differently too. Like, okay, so 9 mice out of the 10 had this response. And I was like, okay, cool. I need to know about that one mouse, the one that it didn't impact him, the one that just kept eating and doing his thing. Like, I want to know about him. And so that's how I started, getting into the medicine and the practice that I have now. Was I started studying those things. I was like, I want to know, how I want to know more about the people that had radical remission. I want to know more about the people that had spontaneous healing. I want to know more about the science of how that mouse was not impacted by 5G. What was he doing differently? What was he thinking? What was going on in that little body? And I think that if we could again
Well,
shift our
how much
focus,
of it we blow that off? We call it genetics, right? When there's no answer for it and no explanation for anomaly, we just go genetics. We just label it
you're
that.
an outlier,
Yeah,
you know.
yeah, they're a very
It's that
outlying variable.
those don't really matter. And I'm like, no, I want to know everything about the outliers. I want to know everything about the ones that screw up your experiments and don't follow the rules. And like, I want to know what makes that, being an entity tick and do make it, so resilient, so unshakable. Because I think that actually shows what is actually capable. The other one showed the weakness in the group. The one that didn't, the one we want to just push it
Well, it's
away.
funny.
Push it away.
That's where we start with when we want to develop a vaccine, right? We find the people that it doesn't affect, right, and that's where we come up with cures for, right? Is through that.
Right.
So
Yeah.
we really should be studying the outlying variables for those research, those studies that they do.
Yeah. No, I think, oh, I won't get started into research and the vaccines, but, um, there's just so much more here. And I think we've, for too long, focused on the wrong things, And if we put our focus again into something that benefited the population, that benefited the world, like what could we come up with? Like if we focused on all of these things that we can't even put words to, that we don't even have the technology to measure, that like you can explain. I want to know more about that stuff. That's why I love herbs too. They're conscious things. I can have the same herb and put it in your body, and it does for you what your body needs, and I can put it in my body, and it does what my body needs. And like science hates that, but I freaking love it. Like how cool is that? We don't even have words to understand all of the magnificence of what is around us, but we'll study and study and study all of the terrible, and break it down to every little pathway of how, if you look in pathology books, there's a million ways to get one disease. I'm just like, wow, like so many
10
different ways.
million ways to get one symptom too. Pick a
Right.
symptom. There's
and,
10 million things.
and so I really just shifted to the other. I'm like, I could care, I don't care. I want to understand how to heal, how to regenerate, how to be well and optimal and thrive. And that felt better for me. And, I feel like it has benefited my patients so much more than me understanding the million ways that you can be unwell, you know.
That's certainly a different aspect in studying. Part of the reason I stopped being a therapist is I'm around that negative stuff all day, and I take it home with me sometimes. Right, I'm wearing my patients' lives on my sleeve all the time, going, man, I want to help you. You're bringing that in, but again, to speak back to the profit driven side. Is we're not studying those things, right? And then you get a pushback from the scientific side that pays, back toward one that can't be research bottled, right? That may be going against their business model, right? Of how they're selling their medicine or how they're selling their response to a symptom of some way. But the I think this side scares the other side, right? Quantum medicine scares another side, and sure, you have to put holes in things as it's doing it. But I think that can be the beautiful way of kind of discovering it. Yeah, not this, but this, right? Not this, but this, and opening our minds to it. I would agree with you, especially on the psychology side, that we are so stuck in the pathology and finding more disorders, finding more things wrong with the human psyche, with the behavior, with society, finding those ways as opposed to trying to find newer ways, right, to heal people, to change, I guess, people's lives, really.
Uh, well, and what you speak to too is actually a neurological mechanism that we have in us that we can either use for good or bad. When you train your brain to look for what's wrong, it's called the reticular activating system. It will find more of that because you've asked for it. It will, if I ask you to look around your room and tell me what you saw that was blue, and then, or tell you to look for blue, and you look around in your room and pick out all the things, and then I have you close your eyes and tell me all the things that you saw that were pink. You didn't look for them. You didn't pay attention to those things, and so your brain will always, give you more of what you're asking for. There's a purpose to it, and so when you understand the way the body works, you can then be like, okay, I don't want more of that. give me more of what makes me well. Let me pick out the things that are going right. Because that's what I have my patients do too in the beginning. Like, write down all the symptoms, everything that's going wrong in your body. I want to know, like, everything, like my nails aren't as strong, or my hair is not as thick, or everything. Be so picky, and then we leave that at that until we start marking things off. And then I want you to start looking, like, every single day, what has gotten better. And when we're trained, just think about somebody with acne. When they look for the pimple, they look for the spot, instead of being like, whoa, look how much of my face is clear. Cool.
Yeah.
And so we train to look for it. And then, because of, if you want to talk about law of attraction and how this universe works, you get more of what you look for. And so again, like, it all matters. Everything that you do, again, this focus, like, what are you looking for? Because you'll find it, and then you'll get more of it, and it'll keep reinforcing it and keep you looking at it, just like with what's going on in this world. If you want more chaos, you can find endless amounts. But does that mean that the beauty and the brilliance and the medicine and all the wonderful is gone right now? No, we're just not looking for it. We're not looking at the people that are healing in their homes right now, like, holy cow, I stopped taking my medication and I didn't need it. We're not looking for all of those beautiful stories of, like, this changed for me, this evolved for me. Let's look for those things. Let's look for the healing. Let's change our perspective, change our focus, ask for more to reinforce that.
That takes some serious
Ask
work. I mean,
yourself.
we have been trained to be critics.
Yeah.
We write reviews, places we go, things we eat, right? We are critics. And we're
Yeah.
taught from a young age too, most of us, not everybody, I'm generalizing, are taught to critique ourselves, right? Where do we fit in this category, on this ladder? Oh, I don't have enough money for this, right? Or, oh, I'm not strong enough for this, right? We're critiquing ourselves along the way and become masters. I actually write about that in my book. We become masters of criticism, right? Instead of being masters of the optimism. But we're trained that way from a marketing standpoint, from a product standpoint, and from an illness standpoint. The clinical practitioners are taught to do that. Let's diagnose from symptom backwards. Let's look at your depression or anxiety from what something terrible that's happened, and work backwards to it. And it really, I love that mindset. When you're looking for something, it is true, especially in mental health. As of recently, I've been pretty boisterous about that the last like 4 months or so on the podcast, 6 months or so. I don't know. Actually, a little longer. But that there's a thing of over therapy. You go to therapy too much, too often. Look, if I'm a therapist, I'm going to find something. If I'm a trauma therapist, I'm going to find trauma, right? If I'm looking for some reason, I'm going to find it eventually, right? And that sometimes going to that type of therapy, the psychoanalysis therapy we're taught, too much. It puts you in a mind frame of searching for the symptoms, searching for poor interactions with other people and relationships to cut. You're staying this constant self-critic, being in that type of therapy too long. I like that you're pointing out that mindset of looking more toward a healing direction as opposed to trying to tracing symptomatic issues that are leading to my pathology that are keeping me ill instead of
Exactly.
moving forward beyond that.
Yeah. Well, and you can, even once you start understanding our subconscious mind and how it works and how it factors into the healing journey, you have to understand, especially with my cancer patients, who have been given a word that really doesn't translate to what's actually going on in the body. And that's a whole different conversation. But um, even when they try to be more positive and they're like, I'm doing this to prevent cancer or to battle cancer, or da, 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 the subconscious doesn't listen to those qualifiers. So even in our attempt to be positive, what are we still doing by holding on to this name that we were given? What's your subconscious hearing without all the qualifiers of I'm fighting it and I'm doing this to prevent it? What's it hearing? Cancer, 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 cancer. And so you have to understand, how this thing works. And when you understand it, then you start, hack yourself, and every single day, do the best you can to, you know, change your existence, change your story, change what you look for, change what you expect. I recently had a patient. I'm just still so excited about her story. She came to me. She had a treatment done with radioactive iodine that pretty much obliterates your thyroid. And so she came with clinically induced hypothyroidism, and she was put on hormones, and they're told that they have to be on hormones forever. There's no other options because medicine destroyed your thyroid. And she felt terrible, and she didn't feel well, and decided to take herself off of the hormones and do her own research and look into things. And her TSH, which is a marker to show how much your brain is asking for thyroid hormone, was like 182, and she dropped it down to 142, which is still critically high. The range is somewhere to like 0.4 to 4 something, depending on the labs, and hers was in the 142 range, what we call a critical value, so high that it's dangerous. And so she came and we ran labs, and she was at 142 when we started, and she just was willing to suspend everything and go all in. And she went all in completely. She did the work. She read the book. She changed her mind, worked, like did the work. And it was time to retest, because when your labs are that high, it's to protect you, it's best to recheck. And so at the 2-month mark, we were rechecking just to see where she was at. And she had worked so hard, but her expectation was to drop it from that 142 to 98, which is still high, crazy high. But that was her expectation. She was working really hard, and she was like, 98. I want it to be 98. But then she was like, you know what? I don't care. It's not going to change how I feel. So I'll just wait to see the labs. And I was like, oh, this is going to get good, because when they're there that this is going to respond in such a different way. And we went over her labs yesterday, and according to allopathic medical standards, she is normal. And she took it from 142, TSH of 142, down to I believe it's 0.4 or 0.6 something in 2 months.
What were some of the things you were doing?
We listened to her body. So we did light, we did diet, we did herbs, we did specific nutrients, we did circulation, we did body electricity. We did everything. I threw everything at her. Like, we went hard, because it was like, we got to do something. We got to do it now, or you may have to look at other things, but I'm never going to tell you what you can and can't do. And boy, did she show up. And, that's one of those things. There were no hormones. There were no prescription drugs used. Everything that she used, you can get on your own. You can do on your own in your home. That's medicine. That's what this physical body is capable of. And her face when she was expecting a 98 and we were way past that. That's that moment that you're just like, what if I would have expected more? Like, can you imagine? Like, if we raised expectations instead of just, that's what I tell my patients. A lot of them come and they're like, I want clear skin. And I'm like, is that it? Yeah. And then we like go into it and they're like, oh, okay, maybe I want, more energy and more this and more this. And I'm like, yes, we've been trained to come and ask for just no acne, not beautiful skin, not, just, we don't want fatigue, not boundless energy and electricity all day long.
Why do you think that is, that we're trained to come in and ask for the this lower end thing?
Because we don't, part of it, I think, is that we've been told it's not possible, that you can't have that's reserved for the select few. And then I think the other is we don't want to ask for it because we don't want to be disappointed if what we believe in is not true. Because a lot of times, when you're making the shift from traditional medicine to, natural medicine, there's this like tug of like, they don't believe it, they're calling it crazy. There's so many judgments and stories, but I really want it. And like, I feel like if anything's possible, this could get me there. But then there's this moment of like, okay, but if I try it and I'm wrong, what am I going to believe in at that point? And so a lot of us don't even want to go there because we don't want to prove ourselves wrong, because hoping for it still feels better than knowing. And again, we're here in this time of like, no, see what you see, feel what you feel, prove yourself wrong. Because what if you accidentally prove yourself right and it changes the world for the better more than you could have ever experienced? And, so we've just been told to not ask. and not expect more, and keep us in this low level vibration, this lack, of like somebody draws the line in the sand of what's possible for you, what you're capable
Yeah, I
of.
mean, I hate to say it like this, but maybe we've been taught too much to just be grateful of what you got, right?
What you,
Right? So yeah, don't ask for more. Be grateful you got one, right? You don't
yeah.
get two cookies, right? So be grateful you got one. Maybe
Yeah.
we're just kind of trained, and I think the system is set up that way though too, right? You go to the doctor for a thing, right? I have this thing. Now I come
Yeah.
to you, right? I'm sick. Give me that thing. That right? I think we're trained that way medically, but I do like the idea of reaching out for something larger than maybe we even expect of ourselves or what's even possible. I mean, we hear stories a lot, right? All the time. I'm sure somebody's got a story. Mostly everyone probably has one where they go, you know what? I got this one friend. You wouldn't believe what happened, right? It's this miracle story, right? That happens. But we do lean hard on what's provable, what can. And to kind of argue the scientific side, those that may argue against quantum medicine or anything on that end, right? Because they have, they think they have this loophole, whatever, because science of this. Those people are also they're on the forefront of a science. There has to be people on the forefront of another science that's pulling along what is or isn't proven, right? I mean, like the first person that's doing surgery, right, back in the day, he looks like a madman, right? He's cutting somebody open. He's a crazy person. What does
Yeah.
he think he can do? Take that heart out and replace it? How dare he think he can cut a kidney out? Right? He's a mad person. But now you're just a neurosurgeon, right? Now you're just an amazing surgeon for doing that,
Yeah.
right? So that there has to be people on that forefront that are
Mhm.
buying dead bodies from the morgue to cut them up, right? to see how they can do a transplant or something, right? And so there has to be people, I think, like yourself, that are on that forefront, digging around out there, applying methods out there, pushing for the unknown to find the impossible, right? I think that quote that shit. I like that. Um,
I
but I
like
think
it.
I think that's necessary, and I think I tried to tie some of that in to a point of psychology with the cognitive approach, using the word belief, which again is a hard thing to describe to people, the difference between a belief and a thought, right? It's hard to walk people through that, but a lot of what you're speaking to, this change, this initial or fuel for it, probably not even the whole thing, is this initiating of a belief change at first, or a recognition that the belief is simply a subjective belief, right? Is where I like to push it. But knowing that the power of that belief is push forward your current life. The current life that you've produced, that you've blossomed and have around you now, is based on the beliefs you've had. And rationally, wouldn't I say if I just change those beliefs over time, I will have a different blossom of life?
Hmm.
So I tried to tie that, those seemingly impossible miracle moments of change, the moment of change, right? The story you just described, to the psychology world of the definition of a belief, right? Of what that belief is.
Yeah. Well, and I think too, belief is so huge. It ties into that story piece. And a lot of people have beliefs about what they're capable of doing. And like, take for instance, our belief in what you can heal. Like somebody drew a line in the sand of like, yeah, you can heal wounds, you can heal, diabetes if you do certain things, but you can't heal lupus. You can't heal cancer. You can't, like, people are doing it. Like, where did we get this absolute of like, you can do this, but everything over here, no, no,
That's
no, no.
true. America wasn't founded on that bullshit.
Hmm.
You know what I mean? It was kind of founded on like we can fucking do anything. You know what I mean? It kind of was. Yeah,
Yeah.
we're got. I mean, even the first cats that got here, I'm half Native American, so I'm split. I'm split either
Sure.
way. I'm like half of me
Sure.
wouldn't have fucking been here, right? The other half was here. So,
Right.
but that American spirit is kind of that. It was we can fucking do anything. We'll figure it out. You want to go to the moon? We'll go to the fucking moon, right? You could argue that too. We didn't go there, whatever, right? But
Yeah.
for those listening, right? You could.
There's a rabbit hole there, but
Right.
yeah.
Well, backstepping. No, but I mean, I think we do need to get back more to that. Yes, we can do that kind of thing, right? Of yeah, we can figure that out. We can find a way to figure this out, or test that, or research that. But so much research, like you said this earlier in the podcast, is tied to if this research can produce something I can bottle, package, and sell, then sure. Here's your grant money. Here's your something. I mean, if we just had people just I don't know, funding vaccines before a pandemic, and we put billions into it, like we did for I don't know, Viagra or something, right? We'd have had a vaccine, right? It'd have been up. We don't do that, and we've said it. I think it's a thread throughout this entire conversation in the science that you practice and the methods you practice. It's hard to do the research if people aren't funding it. If you can't package it, you can't package sunlight. You don't even know half the things that you're connected to and have the ability to reach.
Right.
I don't know. I think
And I think this brings up another point that I've kind of been like sitting with lately is, and like I love research. I read it. I stay up to date. I find it fascinating on so many levels, and I use it when it applies and when it is true. But still, I think there's still this level of we're still outsourcing what is capable for us. Like, is that
yeah,
proven? Show me the research article, the peer reviewed, like all of this criteria. Show me the proof. And like, what if we can keep doing that and keep trying to understand this mysterious and beautiful place that we live in and how things work and try to understand as best we can? Like, it's beautiful. Science is amazing. I love it. But at what point, like, you know, you can read about something all day, like, but you don't, say like you were reading about swimming. Like, why not try to go swim and see what it's like for yourself?
yeah,
And,
yeah.
I think that was the biggest turning point for me because even, on my own healing journey, I listened to what they said I could do. And that was very, you know, not empowering to say the least. And, when I got to my rock bottom, it was like, okay, well, then I'm going to have to freaking give it a shot with the crazy, the non scientific, the unproven, all of the voodoo. I'm going to have to give it a go because I've got no other options. And I kind of want to stick around a little bit longer. So let's try it out. And I can tell you the difference between me just reading about it and trying to conceptualize it intellectually and me living it and breathing it and knowing this medicine inside and out because I live it, I breathe it. I like it is my world. It's totally different. And I don't really give a shit what your research article says because nobody came here and studied me,
Yeah.
you know? And so why do we act like that's not just as important? Like it's beautiful. Use the research. Let's use it to come up with ways to save people and prevent things and evolve in a beautiful way, but don't look to it to see what you're capable of. Because that was another
Like
thing
that.
too, even as a doctor, like when coronavirus came on the scene, I'm like looking around like, has anyone lived through a pandemic? And what did you guys do? And then there's a moment of like, why are you looking for their response? What do you know? What do you believe? And I think as a nation, as a world, we need to start being like, okay, that's great, and that's great, but I live this. I know this. So you can change the story all day. The science can change. All of these things can change, and it's intellectually engaging and fun, and we can have conversation that's stimulating and all of these things. But I know what I know, what I know, and I live it, and I experience it. And so, like, I don't care if your research article says that this is impossible because it was possible for me. And I think there's still like this level of like, yes, let's use it, but don't use it to define. Don't use it as an absolute, just like lab results. I don't look at lab results to give you a word to define you, to tell you if you're normal or not. It's a input. It's a point of reference. Understand what it means. Understand that it was a moment, a snapshot in time, as best we can measure. Not this person is, you know, lupus. This person is, Hashimoto's. No, not even at all. Like it's a group of symptoms too, again, that we've, put under this umbrella term. So like I love science, I love research, but I've gotten to a point where I'm like, I'll take it for what it is. I'll look at what it has to say. I'll maybe look into it in my own way and get my own, again, look at those little outliers and be like, what were those guys doing? But I don't use it anymore to tell people what they're capable of doing or to even put limitations on what's possible in my physical body because, again, it's a limitation. It's like in the boundaries of science you can be as well as science understands. And I'm like, no, why doesn't science come and study us? Why don't they come meet our standards? How did this woman do this work without hormones, without any prescription drugs? 2 months. Go study her. Go figure out like what did you do? You know,
Well,
because there's so many stories about this, but like we want to just act like, oh, there's not something magnificent to be seen there. It doesn't fit into our bubble of what's accepted in science. And so even when you come into this time, we're looking to what does science say about the coronavirus? What does science say about how, what you need to be well? What does science like? Yes, it's important, and you can use it if you know how to use it, but don't let it use you, and don't let it control and dictate your experience. Like, I just want to always push science to catch up with what I'm seeing because I get to see a lot of really cool stuff. I'm like, I go study him. Go study her. Go see, like, how did they do that? How did they do that? Because, I think that's the mystery. I think, and a lot of people are studying these things and it's either getting suppressed or discredited or, completely just burned and buried. But I think that that's where our liberation comes from, where we don't need the science. The science needs us. It needs to try to understand what we're putting out. Um, because, that was a huge shift for me as a doctor. And even in my own healing journey, it was like, well, then I'm going to prove you wrong if that's where you say this ends. Because I don't really want to end there, or that's not good enough for me, you know.
you went on just now what I call a cognitive rampage. That is the
I
definition of it. You went off, as people call it, but I call it a
Yeah,
cognitive rampage.
I
That's
love
that's what that is. And I usually try to I run the interview until I get the person to go off on their cognitive
it.
rampage. And I can't think of a better way to wrap the show up.
Perfect.
Where can people find you? See ya or Instagram, whatever. Put it all out there.
On
Take your program or something.
Yeah, so on Instagram, you can find me at Dr. Cassie Huckaby or at Grit Natural. And my website is gritnaturalmedicine.com, and you can work with me there. I do speaking, I do just education for those self healers that just like to have a new perspective and do it on their own because I'm all about that. Or if you want to be a patient, we do that too, and we go all the way in and we do all of the work. And hopefully, most people don't need me for too long if we do the work right. So that's where you can find me. And I so appreciate you having me on today. It was so good to talk to you.
No, I had a blast. Dr. Huckabee, thank you.
Thank you.
Bye.